we've got our keynote speaker, one Michael Marmot, you may have heard of him as well, Professor of Epidemiology and Public Health at University College London. Michael, over to you.
Thank you. And what I have to say, I think, is complementary to the Darcy review, because I'm going to talk about the causes, the social determinants of health. The current context, you remember, a government that was elected in 2010, and it made no secret its #1 priority was austerity, cutting back the state. And by golly, it's the one thing they were honest about and achieved. The public sector expenditure in 2009-10 was 42% of GDP. That came down year on year. By 2019, that 42% had become 35%. You've heard of the £20 billion black hole. 7% of GDP at today's figures is about £180 billion a year. They took away £180 billion a year at today's prices. And when it was put to David Cameron and George Osborne that Professor Marmot said that might have caused some damage to the health, they said he's wrong. How could you imagine that that would cause no damage? All the discussion now is about the £20 billion black hole. They took away the equivalent of £180 billion a year in public sector expenditure. And guess what happened? Life expectancy pre-2010 had been increasing about 1 year every 4 years. You could take it back to 1920, the end of World War I, and for 100 years, life expectancy had been increasing at 1 year every 4 years. In 2010, the curve flattened. It declined because COVID affected Britain much worse than it did many other countries. So there was a 14-year period where life expectancy did not improve. I cannot find another period in peacetime where life expectancy did not improve over 14 years. What greater condemnation could there be of the way we were governed than the fact that health didn't improve? And, I'm not going to go into it now, but health for the poorest people declined. Life expectancy declined. Ill health increased. We did a calculation, we published this a few months ago, that I wanted to do for a long time. People like me are always talking about poor health of the poor and the gap in life expectancy, higher mortality. I said, let's focus on the rich. I don't mean being concerned about water skiing accidents in the Barbados, people on holiday. I mean, what the least deprived 10% show us is what's potentially achievable in terms of mortality. What if everybody with a level of deprivation below the best of 10% had the low mortality of the best of? And because of the gradient, the next 10%, a bit higher, these are the excess deaths that there would be. Over the period from 2009 to 2020, there would have been 1 million excess deaths linked to deprivation. Now, there was a gradient pre-2010, but the gradient got steeper. And that extra amounts to about 148,000. Prima facie, there's a case that austerity caused 148,000 extra deaths linked to deprivation. And it means that we've got to think about the whole of society, not just the poorest. And that led me, in my 2010 Marmot review, to coin the phrase proportionate universalism, we said we wanted to combine a universalist approach, like the Nordic countries, and targeting. Let's have universalist approaches. We could call it leveling up, there you are. And it deals with the gradient. If you, for example, just to take a non-random example, take winter fuel payments away from all of these people, the people who are just above that threshold will suffer. So we said, universal. You can see why I'm not a politician. Could you imagine, follow me to the barricades. What do we want? Proportionate universalism. When do we want it? In the fullness of time. I don't think I'd make it somehow. So what did we get? What did we get? We plotted life expectancy of local authorities in 2010-12 and the subsequent reduction in spending power of those local authorities. The shorter the life expectancy in 2010, the bigger the reduction in subsequent spending power. In what moral universe could that be the right thing to do? The best construction I can put on this is it was absent-mindedness. They didn't have a clue what they were doing. That's the best construction I can put on it. The worst is, you're sick, we'll take money away from you. The sicker you are, the more money we'll take away. And then to deny that these policies might have had an impact. What on earth were they doing? And look at the reduction, greater than 50%. Central government support to local government over the decade went down by 59%. They declared war on local government. After 2015, people have died of boredom discussing local government funding, but after 2015, they were allowed to raise council tax. So the reduction in spending was more like a third, not 59%. But the more deprived the area, the shorter the life expectancy, the bigger the reduction. And this is healthy life expectancy. You see the huge regional variation. We're working now with the North East Combined Authority and Northumberland. You can see the problems. And the challenges are extreme. Lord Darcy mentioned children, the next generation. One way to look at prospects of the children, the intergenerational equity, is to look at social mobility. What we know in general is rich parents have rich children when they grow up. Poor parents have poor children. Social mobility means that the income of your parents is not destiny. And one way of asking the question is, at the current rate of social mobility, in Denmark, how many generations would it take to go from the bottom 10% to the median income? And in Denmark, it would take 2 generations. In Finland, Norway, and Sweden, it would take 3 generations. In the UK and the US, it would take 5 generations. Why? Because we have big inequality, because we don't spend on early childhood. Our spending on early childhood is below the OECD average. And in Brazil, they have 9. It would take 9 generations. I was asked by WHO Euro, they were having a meeting, and they said, we'd like you to give an inspirational talk on the second day of our meeting from 9:05 to 9:10. I can be possibly prolix this morning. I've got 15 minutes. So one of the things, I didn't show any slides, but I challenged them with this and said, where would you like to be Heading towards Denmark or heading towards Brazil? Because I can tell you, we're heading towards Brazil because of the lack of expenditure on early childhood, because of the inequalities. We're heading towards Brazil. Child poverty rates. Child poverty defined as less than 60% median income for OECD countries, Colombia, the US, Italy, the UK, very high. And if we look at the change in child poverty, defined as less than 60% median income, between 2012 and 2021, we had the biggest increase in child poverty of 38 OECD countries. Government spokesman, I've got to remember that we've got a new government. They're not responsible for any of this. It's early days. But the previous government spokesman would say, oh, we've taken hundreds of thousands of children out of absolute poverty. I won't spoil your day by telling you how they define absolute poverty, but it's nonsense. If you look at what Joseph Rowntree Foundation did for destitution, they defined destitution as doing without two or more of housing, heat, light, food, clothing, and toiletries. And 1 million children in a state of destitution, a 2.5-fold increase in 5 years. If you're on benefits, you get universal credit. JRF and the Trussell Trust calculated what they call essentials. This is the cost of meeting essentials, like the 6 I just mentioned. And this is what you get on universal credit. It's about 70% of what you need to have toothpaste and soap and food. If you're on universal credit, we guarantee you'll get sick. Guarantee, because we won't give you enough money to live. Fuel poverty. We published this report earlier this year with Friends of the Earth. 3 causes of fuel poverty: quality of housing, poverty, and the price of fuel. We have one of the worst in Europe. Over 50% of homes need upgrading. If you look at figures in our report for the quality of insulation, we have about the worst in Europe. And the previous government stopped spending on home insulation in 2012. It was part of austerity. Why should we spend on something discretionary like home insulation? Income and cost of living. Real wages have flatlined since 2011 compared to rise in most OECD countries. And the cost of fuel is 30% higher. I had the suspicion it's the way, because of the way we privatized energy, but I can't quite get to the bottom of it. What I do know is that when the price of gas goes up, you pay more for wind. And I've a friend who's an economist, and I said, can you explain to me why it's an efficient market if when the price of gas goes up, we pay more for wind? And he gave me a lesson in economics 201 or something. And I said, I'm totally unconvinced. But that's the way our market works. If the price, because of gas coming out of Ukraine or Russia, price of gas goes up, even though 2/3 of our energy comes from renewables and nuclear, we pay more. God knows why. Food. How many times have you heard politicians say, oh, poor people don't know how to cook, they're lazy, they're ignorant. I could live on 30p a day. What absolute garbage. If you're in the bottom 20% of household income, to follow the healthy eating advice, you would have to spend 50% of your income on food. And about 20% of your income on fuel. That's 70%. And more than 40% on rent. That's 110%. And if your child needed a new pair of shoes, forget it. Now, if you're in the top 20% and you spend 11% to eat healthily, if you feed your children junk food, you are being irresponsible. Yeah, personal responsibility is very important up here. But if you're down there, that's not irresponsible, that's poverty. That's pretty depressing. The second most common question I get asked is, why aren't you depressed? You'll have to pay me to find out what the most common question is. We had, in my 2010 and 2020 review, the Marmot Review 10 years on, initially 6 domains of recommendations. Give every child the best start in life, education and lifelong learning, employment and working conditions, having enough money to live on, healthy and sustainable places and communities, including housing, and taking a social determinants approach to prevention. We've now added 2, tackle discrimination, racism, and their outcomes, and we're about to publish a report on structural racism in health in London, and of course, pursue environmental sustainability and health equity together. Now, as I've made clear, the government, successive governments we've had since 2010, didn't want to know. Does that mean nothing was happening? Not at all. 40 plus local authorities declared themselves Marmot places. All of these, Gwent in Wales, these are new ones that are coming on stream. So Coventry was the first Marmot city, Greater Manchester, Cheshire and Merseyside, Lancashire and Cumbria. We had a meeting in Leeds last week, Gwent in Wales. And one of my messages to the new government is they did this in the face of brutal cuts to expenditure. They did not sit on their hands and say, come back when we've got more money. They invited us in. We want to know how we could use what we do in local government, in the health service, in the voluntary community and faith sector, business, other public sector organizations, how we can work together to improve health. And so I finish with a quote from a Welshman: to be truly radical is to make hope possible rather than despair convincing.
Michael, thank you very much. Real privilege to. I think many of us will follow you to the barricades. Who saw proportionate universalism? Yeah, we're right behind you. Okay, so if you're a Marmot place, what does that mean? I mean, so if I live in Coventry.
So they took what was initially my 6 recommendations, and they said, right, what can we do to improve early child development? Now, we know that something like 1,000 Sure Start centres closed, but they didn't say, well, we'll wait till we get a change of government and they fund Sure Start children's centres again. They said, what can we do to improve early child development? And Leeds, for example, said, we've looked at your 6, we've got 2 priorities: childhood and adolescence, and housing. So they said, we're going to use our good officers. We try and get the private sector involved as well, social housing, to improve supply and to improve quality. 3, improve affordability. So they said, we do have levers that we can pull. Coventry had a one-stop shop, which for employment advice, trying to get people into work, training on how you do job interviews and the like. What we know in Coventry is the percent of children age 5 with a good level of development went up. the proportion of 18 to 24-year-olds not in employment, education, or training went down. The proportion of people in work earning a real living wage went up. So they worked with business and public sector. So that to take my six domains of recommendation, say, how can we work on those locally?
Yeah, good. The data you presented on life expectancy, obviously I'm very familiar with that. I mean, we published some of that in the BMJ and other places as well. Is there another period in history where, where life expectancy has declined? I mean, other than war?
Well, I mean, not like that. What I can tell you is in the Soviet Union, when Stalin engineered a famine, it was known in the Ukraine as the Holodomor, and life expectancy went down probably about 3 years. And then when the Soviet Union broke up, life expectancy went down more like 7 years. So yes, but that's cataclysmic. We had a democratically elected government that managed to engineer no improvement and decline for the poorest people.
Yeah. Okay, questions for Michael? Okay, while you're thinking about those, in the data on life expectancy, what's the play of the pandemic in those?
So if you remember the graph, went up like that, then it was fairly flat, then fell.
Yeah.
And the fall in life expectancy in the first 2 years of the pandemic, if we look only at rich countries, there was a study from the US, looked at the US and 19 other rich countries. The US had the biggest fall in life expectancy, and then Scotland, England and Wales, Germany and Northern Ireland were next, and then all the others. Interesting, Sweden, which famously
went its own way a little bit.
Went its own way. It didn't look very different from Norway and Denmark. Did quite well. My own view is the Swedes are so well behaved that they didn't need the government to tell them what to do.
It's partly that, but also you talked about social mobility. I mean, there are very narrow inequalities.
Exactly. Whereas, so the two countries that really stood out as doing badly were the US and the UK.
Yeah.
And we had the slowest improvement in health pre-2020, pre-pandemic. So countries that weren't looking good before the pandemic did worse.
Yeah.
And I mean, part of, it's not up to me, but part of my frustration in looking at the US election, if you look pre-pandemic, 2019, for 3 of the 4 years in the US up to 2019, life expectancy fell. The US was doing really, really badly. Now, that's not just a Donald Trump effect, awful as he is. It did fall under his watch, but it wasn't doing well before him. In a way, it was actually, I don't want to overstate this, it was the ill health that caused Trump, not Trump caused the ill health. In other words, people left behind voting for a snake oil salesman because they thought anything must be better than what we've currently got. And of course, he didn't improve things at all. No. But I'd like to hear Kamala Harris say how she's going to reduce child poverty. Biden did reduce child poverty by 50% in his first year, but then it expired. So the US and the UK were doing really badly pre-pandemic, and we did poorly during the pandemic.
Okay, thank you. Right, we have a number of questions. One at the back.
Hi, Michael, Cameron, Bob Klaber, paediatrician, one of the team who runs Imperial College Healthcare. I've got a question sort of for you both, and Cameron, a chance to, pick up a bit about some of the discussions we were looking at to have around the BMJ Commission. So, Michael, like the people of Coventry, whilst hopeful around a new government, I'm not in the let's wait for things to happen on that front. And I guess I'd be really interested in your take on what a largely sort of health and health-related audience here, so people working in the NHS or linked on into it in local authority and voluntary sector, in community groups. What are some of the things we as individuals, we as our teams, we as organisations, and I guess working together as a system can crack on and do that will help try and reverse the terrible story that you've outlined? Hopefully with some helpful policy making and government leadership, but I'm pretty clear I'm not in the wait around mode. But it'd be great to get both of your take on that one.
Who wants to hear from me? Michael.
So each of these 40 plus Marmot places are doing it. And as I said in response to Cameron's question, it can be any one or all of my first 6 recommendations. Trying to improve what happens in early childhood, family nurse partnerships, supporting mothers, because usually mothers in poverty, trying to make sure people get access to the benefits they need, affordable childcare. I mentioned, we've got, I think, we rank third in the cost of childcare globally. I was talking to my own children, and I said that the cost of childcare in London is £18,000 a year per child. And my kids said, we know people who are paying more than that. Now, if you're going to pay £18,000 a year for childcare in London, how are you going to go out to work? If the median income is 32,000 or something, you can't possibly go out to work. So subsidized childcare, providing some childcare that makes sense. So there are very practical things in each of those 6 domains that is happening around the country. In different places have focused on different priorities. I mentioned Leeds wants to focus on young people and housing. Very practical. In one of the places we're working with, they've got local business to guarantee providing jobs for people young people who complete high school. So these are very practical, down-to-earth things that will make a difference right across the life course.
So, I mean, it's very hard to add to anything that Michael says, but I think, I think it's our responsibility, all of us in this room, to prioritise these issues and to champion them, because we all know that it does improve people's health and well-being, improves their outcomes, makes for a better society, a fairer society, and ultimately, as health professionals, people working in healthcare, that is what we should be aiming for. And I think, and you support this, I'm pretty sure that I think all of us here, and we certainly do at the BMJ, we should be advocating for a world that prioritises outcomes related to health and well-being. That should be the number one priority of any government, in my view, because that then allows you to create the policies in health, in education, in transport, in housing, etc., that creates more prosperity, helps address the inequities that we see in our world today. And if you care about the economy, we know the evidence then links it to economic progress as well. So I think there's a lot of pragmatism in what you're saying, but actually ideologically and in an evidence-based way, we should be championing what we're talking about here today, every single one of us. And Bob, thanks for your question. And you're one of the commissioners on our NHS Commission, so you did a great job, along with Michael.
If I could just add...
Okay. I mean, you're adding something to me, Michael. Well done.
Well, but, pre-election, I got asked often, what would be your number one recommendation to a new government? I got 6 domains. So I said, put equity of health and well-being at the heart of all government policy, exactly what Cameron's saying.
Thank you. I learned it from you.
And so I was asked, I can't remember, I think it was Times Radio, about the winter fuel payments. And they were trying to get me to say that the government's wrong. And I said, I'm not answering your question because I care about health and health inequalities. I'm not running the government. I would always want policies that improve health and reduce health inequalities. Whether the government should do this one rather than that one, that's not up to me. But those of us who are concerned about health need to be outspoken. Now, I don't want to start day one of the new government by being the critic, but I do want to stay true to my principles, which is I want policies that will improve health and reduce health inequalities. And if they're not doing it, I'll say that.
Great, thank you. Another question at the front.
Thanks so much. So I'm Leonora Weil, lead for Health Equity and Inclusion Health at the UK Health Security Agency. You described the challenges of bringing us all to the barricades for upstream approaches. So I particularly want to focus on your domain of prevention. So based on your Marmot cities, are there any particular good examples of prevention activities that particularly stood up or examples that we could use in our approaches?
It's a good and challenging question. There are. The 15-minute city isn't being done as a Marmot city, but it fits. So I'm sorry to talk about Leeds, but it's on my mind because I was with them last week and they're celebrating. They've just published their Marmot report. And so making cities walkable, trying to which is prevention, trying to reduce pollution in deprived areas. We know that one of the consequences, or one of the problems with deprivation is high levels of air pollution. Doesn't quite fit in the prevention, but it's pretty close. And making that a priority. Trying to make healthy food possible. Dealing with we've been promoting universal free school meals. It's a classic example of where universalism, the problem, I don't think they do it anymore, but when children with one coloured voucher meant they were the free school meals kids, look at him, free school meals, poor, and the children with I don't think they do that anymore. But if you have universal free school meals and pay attention to food quality, then it's an example of making a difference in early childhood. So there are lots of those specific examples that I can point to.
What about giving people money, just prescribing cash? I know there are trials and experiments of that. What's your view on that?
Well, in general, now I'm looking at the Latin American experience of conditional cash transfer programs. In general, this is really shocking. I hope you're feeling strong. Giving poor people money improves their health. Who knew? Who knew? But that's what there was a recent meta-analysis of Latin American conditional cash transfer programs. And not only did infant and child mortality go down, but adult mortality went down. Gosh. Giving money to poor people improved their health. And I'm an advisor to the Welsh Government on their basic income pilot. Now they're giving money to youngsters who were in care, who were coming out of being in care, and giving, so it's a basic income experiment. We don't know the answer yet as to how it's working, but to the credit of the Welsh Government, they're doing it as a pilot to try and evaluate it. But in general, it does look like if people in poverty get some more money, they use it to good effect, like feeding their children.
Very good. So giving people money rather than taking it away is a good thing. Who'd
It's
have thought
quite
that?
a good thing. This is really shocking. We do a lot of research in these high-quality universities. And we've discovered that if poor people have a bit more money, their health improves.
Very good. We'll take one more question. Yes, at the front. You're sort of at the front, aren't you? A microphone's coming. So you're projecting very well. You started well. Yeah.
Thank you, Professor Marmot. I'm Patience Okure. I'm a GP and I'm clinical director in NHS Sussex, and I lead on children maternity and health inequalities within the population health team. I was just wondering, you talked about the Marmot cities, and I was wondering about early childhood starting well. I wonder, pre-pandemic, a lot of the family and children centers had to close down due to funding. And I just wonder, how did these cities get past this? Do they now have a one-stop clinic or more children and family centers? Because where I come from in Sussex, we still have those children and family centers have remained closed, and we have dotted ones, which means people with the greatest deprivation have to travel to the few ones, and sometimes they never go there. And we all know that children and family centers used to be a place where everyone came to, whether you were poor or you were rich. But rather now we have those mother and baby groups that are funded sometimes, and also more popular on social media, which then means that those who are with digital exclusion and the poorer people might not be able to get there. Just wondering how they got past this, because it's something that I'd really want to know, would interest us.
Well, let me put it in context. I mentioned it briefly in passing. If you look at UNICEF figures, and the report card 16, I think it was, at spending on children aged 0 to 5, the average for OECD countries, it's a few years ago, was $6,000 per child per year. In Norway, they spend $12,000. Sweden, a bit less than $12,000. France, $9,000. The average is $6,000 per child per year. UK, $4,000. US, $3,000. We don't spend any money on early childhood. We spend a third of what they spend in Norway. This is equivalent, purchasing power parities. We don't spend any money. The reason I like the US so much is they look worse on these statistics than we do. So we're not the worst. We've always got America to look at. But we don't spend any money. So what you're describing is a consequence of how mean we are when it comes to investing in the next generation. And that's why our social mobility is so poor. That's why, as Lord Darcy said, children are waiting for mental health services, why parents can't go out to work, and on and on and on. And what you're describing is the consequence of that.
Michael, thank you very much. It's always a real privilege.